Now, the impact of the COVID-19 pandemic can still be felt in all spheres of life today. Young people, specifically in South Africa, have been affected by the lack of physical interaction due to the national lockdown that was implemented. The Bureau of Market Research has done a study about this and found 3 key areas where young people were affected: substance use and abuse, sexual exploitation, and cyberbullying. More than 1,000 young people took part in this research. To tell us more about this, it's the lady who led this study, Dr. Antoinette Basson. She's a BMR Research Director and head of the Youth Research Unit. Doc, good afternoon. Welcome to today, and thank you very much for your time. One might presume that there's no surprise really in what you found, because people were locked down and they would tend to rely on substances to chill and relax during the lockdown period. But I might be wrong. Did you see any surprises in your findings?
Thank you very much, Dan. And it's exactly like you said, that on the one hand, we were not very surprised by the research findings, because for the past 10 years, we've been doing research on the behavior and the impact of this on young people. And we've noticed that really young people are faced with challenges. But I think it's still alarming that young people are using substances, they are abused online. There's a lot of incidents of cyberbullying that they experience, and that they desperately are in need of adequate support and support services in South Africa to help them.
Okay, let's go through these 3 key areas that you've highlighted through your study. Let's begin with substance use and abuse. Tell us, what did you find?
Yes, Dan, with substance use and abuse, what we specifically find is that besides illegal substances such as your tobacco products as well as your alcohol, young people are using a variety of illegal substances. And something that really clearly stood out in this study was the use or the increase of use of over-the-counter medication. And very often young people mix over-the-counter medication with other substances that definitely have a tremendous effect on their physical health as well as their emotional state and their behavior. So we definitely saw an increase in that, specifically if we compare the results with our previous studies that we've conducted since 2012. And that is really alarming for us, because we can see that their behavior results in a risky situation for young people with terrible consequences.
Yeah, I mean, there's all kinds of products that are available very easily to young people and anybody, in fact, in our country today. And it's the use of illicit substances is equally concerning.
Definitely. It's also easy accessible within our communities. That's quite something that came out of this study that's quite alarming and stressful, is that really that children confirmed that within their communities, substances, specifically illegal substances, are freely available. So that's quite something that we also need to focus on, that children access illegal substances quite easily.
Yeah, and coming into the home, I mean, it is not always a guarantee that spending more time indoors will always be a protective factor. That's another point you make around substance use and abuse, especially if you have a dysfunctional family environment.
That's correct, Dan. We thought maybe during the lockdown, children and young people are spending more time with their family members. Unfortunately, our research is showing that that's not always that positive, especially in households where there's a lot of instability due to unemployment. A lot of people lost their jobs during that time. So we saw that this really impacted on children and young people. And a lot of the study actually showed a lot of stressful situations. Children and young people are really impacted by this.
Yeah, let's move on to the next aspect of your research, which is about online sexual exploitation and abuse. What did you find there?
Dan, this is one of the alarming things that we have been studying also for quite a number of years. And what really is concerning for us is that this is increasing as children are also gaining more access to technology, especially during the COVID. A lot of children had to go online for educational purposes as well as for communication with family and friends. And unfortunately, this also increased their vulnerability to online sexual exploitation and abuse. Our study found that a lot of children have reported that the content online have changed significantly and that they have been exposed to sexual content as well as violence. And unfortunately, our study confirmed that almost 90% of the young people who participated in our research has been exposed to pornographic material, which is, of course, illegal in our country for children and young people under the age of 18 years.
Yeah, and one can only imagine the impact. There will be a significant emotional and behavioral impact of all of this.
Definitely, we saw that children are completely overwhelmed. They experience mixed feelings. And the sad part is that they do not always report or reach out to adults and like parents and caregivers to inform them about their online experiences.
Yeah, finally, cyberbullying, Doc. I mean, we know really it's really bad, and we've discussed it with several psychologists and experts here, and it rears its head sometimes in our school environment. But with your study, what did you find about cyberbullying?
Cyberbullying also has always been a concern for us because of the significant impact on young people's behavior. We often hear about very sad cases where young people commit suicide due to cyberbullying. So this is very close to the heart of the Youth Research Unit. We really want to produce South African research information on this topic. We definitely find during the COVID, where children had limited social interaction, they were victims of cyberbullying, a lot of false statements, a lot of rumors being spread about them by their peers. And unfortunately, also what we saw in the research, although children inform adults about this, the response is not always adequate. So the child does not receive the necessary support needed to cope with that traumatic experience. And they do not always know how to handle the situation. And that often results in them becoming bullies as well.
Dr. Basson, finally, we're beyond the pandemic. You've done this research and you've seen the impact on our young people of lockdowns and all of that, especially in these three areas. As we sit here today, are our young people still faced with these big challenges? And from your research, what do you hope can be done? How can it be used besides creating awareness?
Thank you so much. Yes, definitely. I think the impact is going to be with us maybe for still many years to come. And I think definitely we see this amongst our young people and our children. And what we really hope for is to provide South African professionals and the government with usable research information that they can use to implement and to really improve the situation for young people in South Africa. Something that's really needed in our country is youth-specific support services, services that can really address the needs of young people and provide them with the support and help that they desperately need.
We need focused support, focused services to help our youth. Thank you very much for your time this afternoon on Today. That's Dr. Antoinette Basson. She is with the Bureau for Market Research, BMR, and she's a research director there and the head of the Youth Research Unit.